Hi, my name's Adrienne Wagner, and I'm 28 years old, and I was just recently diagnosed with endometriosis. Now, for most women, getting a diagnosis of endometriosis is extremely hard due to the lack of education with our healthcare providers. So, I thought I would tell you my story on how I went about actually being diagnosed. So, about a year ago, I started having strange symptoms. The very first one, now I know this is going to sound like a TMI, but let's get real, we're adults. I was having pain every time I would have an orgasm. And it was pain that was centered in my rectum, of all places. And at first I just brushed it off. I thought, well, maybe something's wrong with me down there. But I noticed within a few months that the pain started evolving into pain during sex. And that I knew for sure was something that shouldn't be happening. And it was also centered on my rectum area. And then after that came the really painful periods. And my whole life I had normal periods. So the cramping that I was experiencing, the fatigue, I was literally buckled over to the points where I felt like I was going to pass out type of pain. I knew it wasn't normal. So I decided to make an appointment to see my primary care physician. And he wasn't very much help. I went to see him and he ordered an ultrasound. And when it came back clear, I soon found out afterwards that endometriosis cannot be found on ultrasound. When I first thought I had endometriosis, I had Googled my symptoms, and that was the first thing that came up. In addition, my mom actually told me that she had it at my age, so more than likely that's exactly what I had. So I told my doctor, despite it being clear, that there's something wrong. I needed answers for this pain. So he told me that I should see a gynecologist. So I made an appointment with the gynecologist, and our first appointment that we had together, I told her that's what I had a feeling that I had. I told her symptoms and family history. She actually told me that the rectal pain was not a symptom of endometriosis, despite it actually is. And she also said that my fatigue was not a symptom of endometriosis, which after doing a simple Google search, it's medically documented that these are symptoms. So she did a pelvic exam of me, and exactly where I had pain, where I have sex, she said that more than likely it's endometriosis. After that, she told me that I should look up an injection hormone therapy called Lupinetta. She explained that it would put me into medical menopause, and the aim was to kill the endometriosis. So I did do a little bit of research, and I also, upon my research, found out that there's a procedure called a laparoscopy. And basically, a laparoscopy is the only way that you can actually diagnose endometriosis. You cannot see it on an ultrasound. I was so mad when I found out that you can't see it on an ultrasound because my primary care doctor was not educated on it. So, being that I had a little bit of education on having a lap, when I went to see her, I asked about it. I asked if we could do one to actually diagnose it and to see if we can excise the lesions. And she did not want to do a lap. She said that should be the last resort, and doing the hormone therapy should kill the endometriosis. So at that point, I didn't know too much about it, and I just went with what she said. I trusted her. So about a few weeks later, I started joining support groups on Facebook. That's where I really became educated. I learned that the hormone therapy only masks the symptoms. It does not kill endometriosis. And as a matter of fact, nothing can kill endometriosis because it's incurable. the only surefire way to get relief for a while is to find a specialist to excise the lesions, which is cut it out of you. Ablation is not a good form of surgical procedure because it will only burn the top layer of tissue, and if there is even a single microscopic cell left, which would lie underneath the tissue, can and will grow back. So I started looking into specialists, and all the while I'm on this hormone therapy, I'm having the hot flashes, my mood is all over the place, and I also end up with gastritis and IBS, which caused a whole bunch of pain besides the endometriosis pain. I also had crazy amount of bloating too due to the endometriosis, so I was just completely uncomfortable all the time. As a matter of fact, I had upper back pain, and I found out that I was diagnosed with level scoliosis, which is a curvature of the spine. So my body is just in pain no matter what at this point. To the point where I actually go on a medical leave of absence from work. So I start looking into seeing a specialist to do a lap to officially diagnose me, to make sure what I had was actually endometriosis and to try to get rid of it. And I was successful. I found someone. He listened to me. He even asked me, why did she want to do the hormone therapy instead of doing a lap? And I told him I actually asked for it. And she didn't want to do it. She just wanted to do the hormone therapy, which I'm pretty sure is money. And within a week, I was scheduled for surgery. And I ended up having my lap on November 12th. They found it. I'm between stage 1 and stage 2. They found it about 3 lesions on top of my bladder area. One pretty decent sized one on the back side of my uterus, as well as a whole bunch on top of my rectum. Which is the reason why I was having rectal pain during orgasm, rectal pain during sex, and I would just have rectal pain periodically all the time, just weird stabbing sensations. So there it was. I have pictures. I have, an understanding now of this disease and what it's going to take probably throughout the rest of my life to get some relief. I'm now 2 weeks post-op. I have 1 more week before I go back to work, and the healing process it's been difficult, I could say. The first week was a lot of pain. I was practically bedridden. I didn't want to get up because I didn't want to irritate myself, and every time I stood up, my stomach felt like I had just a giant weight in it, and it felt hard, which is obviously due to all the inflammation from the surgery itself. Second week, I'm getting around much better. I still can't wear anything around my incisions, which is a reason why I'm taking 3 weeks to go back to work, because my work, we have to wear pants, which I would be in pain constantly all the time. So I'm taking 1 more week to heal, and I'm praying that I won't have to have another surgery for a while. If I do have to have another surgery, I will more than likely find or try to find a higher up specialist, someone that's a bit more educated. And the fact that I had to advocate for myself, that I had to tell my doctors, no, this is what I have, and them saying, well, that's not a symptom of it, that's not a symptom of it, and it really actually is, that's saying something. I mean, us women dealing with something like this, we shouldn't be treated like we don't know what we're talking about. It's extremely sad that our doctors, the people that we're supposed to trust, are not educated enough to be able to diagnose endometriosis and to actually listen to their patients. I mean, we need some sort of all the way around education for gynecologists around endometriosis. And at one point, I had actually gone back to my primary care doctor for my upper back pain. And I exclaimed to him that I hope one day we would find a cure for endometriosis. And then he looks up at me and he smiles and he says, "Are you married?" And I said, "No, not yet." And he told me, "Would you want to have a baby in the future?" And I said, "Yes, if I'm able to get pregnant." And he actually said that if I get pregnant, the endometriosis will come out with the baby and I will be cured. Straight from the horse's mouth, that's exactly what my doctor said. And at that point, I just laughed because I knew that that was absolute BS. How can endometriosis come out with the baby when the endometriosis is inside my abdomen? Attached to other organs. And it's just nuts what these doctors are telling us. And it's completely false information, leading us to have to jump through hoops to be able to get answers. It's just ridiculous. And I'm really, really hoping that one day our voices will be heard and we won't have to jump through hoops. We can go to one doctor and they will know exactly what endometriosis is. They will know exactly what the symptoms are. They will know exactly that, birth control doesn't always help people, that the hormone therapy, it's not going to kill the endometriosis. It's just going to mask the pain. For some, it did not mask the pain for me at all. I still had the pain. But to do a laparoscopy surgery, to officially diagnose, no more ultrasounds, no more blood tests, no more CT scans, because it doesn't show it. I mean, it's just unbelievable. And to have every single gynecologist a skilled surgeon with excision surgery and not ablation, and to know what it looks like, to know what the different coloration of endometriosis cells look like inside of your body, and to know where to look for it. I mean, one of these days, soon, I hope, with all of the women out there fighting, we're going to be marching in the streets for the Endo March in March of 2019. We should not have to march in the streets for basic health care. Anyways, thank you for listening to my story. If you have any questions about endometriosis or, any concerns for yourself, let me know, because I've definitely educated myself way more than my doctor ever could. And it's due to the ladies in all of the Facebook support groups. I owe you ladies a lot, because without you, I would be lost. Anyways, thank you, and keep fighting. We'll get through this and hopefully find a cure. Thank you, ladies.